I'm very pleased to be here today to address you on the subject of implementing a global human resources for health education reform, in which in this session we will look at country examples and experiences. This is a subject which is at the heart of WHO, and we are taking steps to assist our member states reframing education of health professionals to meet the changing requirement of the 21st century. The WHO and the Global Health Workforce Alliance, as you know, have recently convened the third Global Forum for Human Resources for Health, which was held in Recife, Brazil in November 2013. We see the PMAC as a great opportunity to build on and to strengthen the Recife outcomes and the global agenda on transforming health workforce education. First, in order to tackle the human resources for health issue, allow me to mention and underline something which is not the focus, of course, of the PMAC this year, but it is essential to acknowledge the global migration forces of the health workforce, and that this mobility can create challenges for those countries most in need, both in terms of deploying the healthcare workers and in ensuring their continuous education and in making best use of those who have been trained in the country. The 2010 Global Code of Practice on the international recruitment of health personnel takes steps to address potential effects of brain drain, and it is important to ensure that this code of practice is adhered to by all member states and partners, and not just some. And I must say that we still have progress to do in this regard. But of course, this is not sufficient, and this is why we are discussing education. We need to reform the education of the global health workforce and ensure that curriculum consider and addresses the needs and challenges of the next 10 to 15 years. As you know, these needs and challenges were highlighted in 2006 World Health Report, Working Together for Health. The picture, which was presented just 8 years ago, has not changed much, apart from a more acute understanding of the urgency of addressing non-communicable diseases and the change of demography linked to aging of a population, which will certainly require a radical change of how health services operate, and therefore the need for development of new career paths and new jobs, new types of work for workforce. We, as the country want to aspire to achieve universal health coverage, new demands will be placed on health personnel, and more health personnel will be required. There will also be an absolute need for more efficient use of existing health workers, and new competency will be necessary. A significant acceleration of efforts, including greater investment and the adoption of innovative education and care delivery models, are required if universal health coverage is to be achieved. This must, however, be a truly inclusive process so that we can best consider the needs of those we are working to serve. We need to find shared solutions to the common challenges of human resources for health. WHO is working with partners and has identified elements of health workforce education which need to be addressed through effective reform, and is working to provide tailored guidance to assist countries in this process. We need all to work together on this critical endeavor. As we know, WHO has worked in particular recently to develop guidance on education reform, and during the recent third Global Forum on Human Resources for Health in Recife, we launched the latest guidelines on transforming and scaling up health education, professional education. These new guidelines, I hope, will be useful to assist our member states and partners in finding their own way of reforming health education systems in their respective countries. Ladies and gentlemen, effective reform of the education of a global health workforce will not be easy and will present many challenges, of which I will only mention 4 in this introduction. First, as already outlined by Julio this morning, there is a need for much stronger institutions. We know that strong health systems are essential, but we must remember that strong health systems require robust training institutions. Without these strong institutions, there will not be a properly trained and effective workforce in place to drive and strengthen health systems. For institutions to be strengthened, they must be properly regulated, well-funded over the long term, and empowered to undertake reform steps, including curriculum reform. We need to move beyond achieving quick wins, but rather develop a long-term strategy for health education reform. This strategy must be future-oriented and targeted to reach broader populations. This will not be possible without strong institutions. Health system can only be strengthened with a strong health workforce that is fit for purpose, fit for practice, and securely in place. This session provides a great opportunity to hear from countries and partners about their experience and how they work to establish stronger institutions to address the future needs of a global health workforce. I look forward to learn from what has worked and what still needs to be improved upon. Second, also as mentioned this morning, there is a need for stable and predictable funding to this stronger institution. If we want to address the gaps in the supply of health workers, education reform will be important but expensive. We should not be naive about that. And we need to consider here today the financial requirement for education reform and how to address each of them in a practical way. In combination with a financial requirement, we must also consider how to be efficient so that we get the most health for the money. Third, and this will also be touched upon, there is a need to reduce dropout rates. We need to address this as a priority. The practice of individuals withdrawing from health education before completion undermines the whole health system and is not the most efficient use of resources, of course. Options to address high dropout rates will be important to consider during our discussions in this session. And finally, there is a need to increase efficiency overall. It is currently believed and modeled that about 20 to 40% of resources spent on health are wasted. What a shame. Reducing this waste would greatly improve the ability of health systems to provide quality services and improve health. Opportunity to achieve more with the same resources exists in all countries. As an example, expensive medicines are often used when cheaper, equally effective options are available. In many settings, antibiotics and injections are overused. There is poor storage and wastage in common. So there is fund available for the workforce and for training the workforce if all these efficiency gains are realized in other sectors of the health systems. So to conclude, it is clear that there is no single easy solution and that implementing reform to global human resources for health education is very complex with many factors to consider. There are no golden bullets. To move forward, we need to review and analyze experiences from the ground at all levels in their proper context. But this must be done in a consolidated, comprehensive manner, which is also to be methodical. In closing, I would like to highlight the importance of having the debate on health workforce education and its reform at the global level, as no single country alone will be able to address fully this issue by themselves.